I was 28 years old.
I was 31.
I was 20 years old.
I was 45.
I was 17 when I first found the lump, and at age 24, I noticed a change and was diagnosed.
It happened one day, a random day. I was just showering and I felt this lump on my breast. Didn't have any pains. It called my attention because it's not normal to have a lump in your breast at 28.
I found my own lump. I found the tumor and it didn't feel right. And at first they were saying it was a benign cyst, like my past benign cysts. And that's my advice to young people as well, is to trust your instincts, know your body. If you don't feel something's right, go back for a first, second, third opinion and keep pushing till you get to the bottom of it.
Easter season, I felt a little lump, like the size of a, let's say, a bean. No pain, no signs of having any problem, absolutely.
I found a lump in my right breast and I did get it checked out, but it was passed off as a cyst. But I did get a few opinions because I definitely thought that something wasn't right with it.
Having met with the doctor, he decided that everything was fine based on the results of the mammogram, the 3D mammogram. Everything was fine with me. So I asked if he would do ultrasound, and he said there was no need for one. And after speaking to him a few times about it, he said yes, we could do an ultrasound. Having done the ultrasound, they detected a change in shape of a lump in my right breast, but everything was normal in the left breast. And I was not happy with that, and I ended up seeing that breast specialist a total of 4 times. And the last time he said I just needed to see the dermatologist because it was just eczema of the nipple. I was able to see the dermatologist after much trying, and she took one look at it and she said, when she kind of arched her head, and I said, are you thinking Paget's? And she said yes. And I said, are we going to do a biopsy? And she said yes. So she did, and the results came back saying it was Paget's cancer.
It wasn't until I was 23 years old that I had to return to the doctors because something definitely wasn't right, and that's when I was properly diagnosed with stage 4 breast cancer.
I wish I would have known that men could get breast cancer. I wish I would have known how much of a life-changing event this was going to be. I wish I was more proactive.
Ask your GP or OBGYN, whatever doctor you're seeing, if you feel something suspicious, to have them examine it as well and give you their feedback. And then move to an ultrasound, and from there you move to the biopsy stage.
As soon as the doctor discovered it was breast cancer, we went straight into treatment. It was full-on chemotherapy. We started with hormonal therapy, we did chemotherapy, and we did surgery.
When I was first diagnosed, the first day of my surgery, even the second day, I said, I will know how to fight. And I asked myself to time me and say, take it one day at a time and go for it and fight it. And here I am today.
I did a double mastectomy first, and I did chemo, 6 rounds of chemo and 25 rounds of radiation. I had some very good people around, especially from the wellness program at Breast Cancer Foundation, and they were like totally supportive.
Life after breast cancer is great. Some days it's tough, but I have the support. Now I'm happily married. I have a miracle baby. She's 2 years old. She's the best thing that has ever happened, and it's just proof that there's life after cancer. When you take time to find the right treatment, speak to the right doctors, you can move on. Still, you're in recovery, you're still afraid, but it's okay, because that's part of the healing process.
I'm in remission, and I think that's going to continue. And As it relates to just going forward, I still have a lot of support from the Breast Cancer Foundation, the wellness program, with counseling, and just the foundation offers me a forum so I can freely express myself and share how I'm feeling with people who are actually going through the same thing. So how am I doing? I think I'm doing very well with the help that I've been given.
If something doesn't feel right, trust your instincts. Don't give up. Make sure that you get to the bottom of it. Until you get a biopsy that says benign, completely safe, nothing, that you are completely healthy, then you're really not sure. So it's just really important. It doesn't matter how old you are, 15, 18, 25, 30. If something isn't right to you, do not let anybody deter you, whether it's a family member, a friend, say, oh, that's nothing. And also don't be deterred by fear. You have to, early detection will save your life.
Yeah, it's being proactive about your health. You see something, if you feel something wrong, you feel a lump or whatnot, don't wait, months and/or years for me, and it was what it was and stuff, to go actually be proactive and tell the doctor. And if you're not comfortable with what the answers that you're getting, go to somebody else. Get second opinions, third opinions, fourth opinion, whatever it is, until you feel comfortable with your health. It's your body, it's your life. Live it.
So I must say I am the first in my family, both my mother's side and my dad's side. So I'm the first one. It's not to say, well, it happened to dad or mom or whoever. I'm the first, so there should be something we could learn from there.
Just make sure to stay on top of it, do your self-examinations, eat healthy, go online, read. A lot of people will say, don't go, oh, the internet has too much. Make sure you're looking at reputable websites, but there's a lot of information out there for people. So take advantage of it. If one doctor gives you one advice, don't be afraid to go for a second opinion or a third.
My message to the future generations, the girls out there, the young girls between 15, 28, 30. If you feel anything that isn't right with your body, find someone to talk to. As simple as knowing your body can change everything. There's the Breast Cancer Foundation, a group of ladies who will be more than happy to help you. If you're underage, look for a person who can help you, your mom, your aunt, a teacher, a best friend, and you can seek that attention if you can. If I had to go back in time, I would have never taken 2 months to go back to the doctor. If you feel something, early detection is the key. That way, if you feel something, you go to the doctor and you're not worried anymore. It can be quite scary because you don't want to hear that it's cancer. It can be anything, but it's better safe than worry, right?
If you see something wrong, if you detect something wrong, if you discover that there's something different with your body, you know your body better than anyone else. You need to have it investigated, and do not just brush it aside saying tomorrow it's going to be better or whatnot. Have it investigated, and there's nothing that compares to an early diagnosis.
Don't give up on your fingertips. The mammograms that you have could tell some things, but you're feeling, you study your body and know what's normal, what we're used to feeling, from what appears different as we go.
Go see a doctor, talk to somebody about it, and if your diagnosis is suggesting that you do have cancer, just go with it. And you'll be thankful that you did that in the end. So don't be afraid. Having a cancer diagnosis is not the end of the world. The times will be challenging as you try to deal with it, but it's not the end of the world, so you can do it. And there is support if you need it from the Breast Cancer Foundation. And with that, you can do a very good job.
Why we need to care is because by the time we normally figure it out, that something's bad, something's wrong with us, it's too late, and it can metastasize into more cancers throughout the body, and sometimes it can be too late for men.
If I could talk to my 20-year-old self, I would tell myself to continue to be proactive about my health, continue to be persistent when I feel like something is wrong, because at the end of the day, I did accept that, you know, everything I was told was right and it wasn't right. So I would definitely say, just, you know, if you feel something is wrong, trust your gut and go with whatever your mind is telling you. And you know, this doesn't only affect women and girls, like breast cancer can affect boys and men as well. So this message goes to everybody.
Hi, I'm Dr. Laura Cooper, one of the breast surgeons at City of Hope. Today I'm going to talk to you about self-breast examination. Around 8 out of 10 women detect breast cancers or breast lumps themselves. Therefore, it's important that every woman understand the basics of a self-breast examination. There are actually two components, look and feel. For the first part of the exam, looking, you want to stand or sit in front of a mirror. With your clothes off, you want to look at both breasts to see if there are any differences between the two. Examine the nipples to see if there's any difference between the two. Is one redder than the other? Is one pulling in? Then you want to put your hands on your hips and turn from side to side to see if there are any changes. While standing, you actually want to put your arms forward on your hips, because this will bring out lumps that might not appear otherwise. It's important to raise both arms above the head. This will draw out any puckering or dimpling for masses that might be underneath the nipple. If you're standing like this and you have a mass that's kind of in the lower part, you might not see it at all. But when you raise your arms, what happens is that mass kind of stays and then the skin kind of pulls in as you're pulling up. That was the first part of the examination. For the second part, you want to be lying down. You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion, from the collarbone to the sternum, or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out, something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination at the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.